Good afternoon to you all. Today we are going to revise on rectum, anal canal and ischirectal fossa. Coming to the rectum, first we are going to read about the rectum. What is rectum? Where it is present? Rectum, it is the most distal or terminal part of the forehead. Okay, it is the most terminal part of the forehead. See, this is the terminal part of the forehead. Okay, what are the parts of the intestine? Ascending colon, transverse colon, descending colon. Descending colon will continue as a sigmoid colon. Sigmoid colon will continue as a rectum and anal canal. Okay, today we are going to discuss about this rectum and anal canal. Okay, what is rectum? It is the distal part, a terminal part of the forehead. Where it is present? It is placed between the sigmoid colon and anal canal. Okay, where it is located? It is located in between the sigmoid colon and anal canal. Okay, but it is devoid of sacculation. Sacculation is nothing but a series of pouches. Okay, it will not arrange in an pouches manner. Okay, it is devoid of sacculation. Sacculations are not present in the rectum, whereas it is present in rest of the intestinal part. Okay, whereas appendices epiploica, it is absence of appendix epiploica. It is nothing but these are the appendix epiploicas. Okay, these are the fat of pouches of fat. Okay, these are absent in this rectum. These are also absent in this rectum. Okay, next tinea coli and mesentery. Okay, this is the tinea coli. Okay, this tinea coli also absent in this rectum, whereas mesentery is also absent in this rectum. So how we will differentiate this rectum from the rest of the intestine? It is devoid of sacculations. Appendix epiploica is absent, whereas also tinea coli is also absent, whereas mesentery is also not present in the rectum. Okay, so where it is present? It is present in between the sigmoid colon and anal canal. This is the rectum. Okay, next coming to the situation, location in the body. Okay, location in the body. Where it is present? It is present in the posterior part of the lesser pelvis. Okay, where it is present? It is present in the posterior part of the lesser pelvis. Okay, it is next coming to the course. Course means it is nothing but it is continuous as a, it is the continuation of the sigmoid colon at the level of S3, at the level of opposite to S3, third sacral vertebra. Okay, at the level of the third sacral vertebra, the sigmoid colon will be continuous as a rectum. Okay, and it will be ends by continuing as an anal canal. Okay, it will be ends by continuing as an anal canal. Okay, next, anorectal junction. Anorectal junction is nothing but this is the anorectal junction in between the rectum and anus. Okay, where this anorectal junction is present, it will be lies 2 to 3 centimeters in front and little below the tip of the coccyx. Okay, all these things will be discussed seen in the next slides. Okay, this is mainly the rectum is devoid of tinea coli, whereas appendix epiploica, whereas sacculations are not present, whereas mesentery is also absent in the rectum. Okay, where it is present in the posterior part of the lesser pelvis. Okay, it is the continuation of sigmoid colon and continues as anal canal. Okay, see, this is the extension and course of the rectum. See, this is the continuation. Okay, this is the descending colon. This descending colon will be continuous as a sigmoid colon. This is the sigmoid colon. Okay, this is the rectum. Okay, at the level of S3, at the level of the S3, third sacral vertebra, it will be continuous as a rectum. Okay, at C, this is the rectum. Okay, it will be continuous as an anal canal. Okay, it will be continuous as an anal canal. Where it will be lies? It will be lies at the tip, 2 to 3 centimeters in front of and little below the tip of the coccyx. See, this is the anal canal. Okay, this is the anorectal junction. This is an anorectal junction. Next, coming to the measurements of the rectum. Okay, these are all the external features of the rectum. Okay, measurements are nothing but length. Length is nearly 12 centimeters. Okay, its length is nearly 12 centimeters, whereas its diameter, its breadth is nearly 4 centimeters. Okay, length is 12 centimeters, whereas breadth is 4 centimeters. Okay, the lower part is dilated. Okay, the most lower part is dilated part of the rectum is called as a rectal ampulla. Okay, the lower part of the rectum is dilated. It is called as a rectal ampulla. Okay, next coming to the curvatures, it has two anterior curvatures and three lateral curvatures. Okay, it has two anterior curvatures and three lateral curvatures. See, anterior curvatures are nothing but this is the sacral flexure. Okay, curvatures are also known as flexures. Okay, curvatures are also called as a flexures. Okay, this sacral flexure or curvature is followed by the curvature of the sacrum and coccyx. Okay, it is followed by the curvature of sacrum and coccyx. Okay, perineal flexure. How the perineal flexure is formed? By backward bending of anorectal fissure. Okay, backward bending of anorectum. Okay, anorectal junction. Okay, next coming to the three lateral curvatures. What are the three lateral curvatures? Upper part, middle part, and lower part. Okay, from the anterior view, we are going to see two. See, this is the sacral flexure. This is the perineal flexure. Sacral flexure is followed by the curvature of the sacrum and coccyx, whereas perineal flexure is followed forward is a backward bending. It is a backward bending by anorectal junction. Okay, anorectal junction. Okay, coming to the three lateral curvatures: upper, middle, and lower curvatures. Okay, this upper curvature which will be rise in a rate. Upper and lower curvatures will be its convexity will be towards the right side, whereas the middle part, the convexity is towards the left side. Okay, upper and lower convexity is towards the right side, whereas this middle one will be uh, middle part will convexity is towards the left side. Okay, so by seeing from the left side view, the most prominent one is the middle part of the rectum is most prominent. Okay, these are the curvatures of the rectum. See, these are the flexures. Okay, this is the sacral flexure, this is the perineal flexure. Sacral flexure is a backward, its convexity is towards the backward, which will be followed by the sacrum and coccyx. Okay, whereas this perineal flexure is formed by it is a it's convex towards forward. Its convex is towards forward. Okay, it is formed by puborectal sling. Okay, this puborectal sling is formed by levator ani muscle. Okay, puborectal sling of levator ani muscle. Okay, these are the anterior curvatures in anterior view curvatures. Okay, anterior posterior view curvatures, whereas three lateral curvatures. Okay, this is the median plane. Okay, whereas upper and lower part, its convexity is towards the right side. Okay, its convexity is towards the right side, whereas the middle part convexity is towards the left side. See, this is the convexity for the middle part, this is the convexity for the upper and lower parts. Okay, upper part convexity will be lies at the level of S2 S3 vertebrae, at the level of S2 S3 vertebrae. Okay, whereas middle part at sacrococcygeal junction, middle part at the level of sacrococcygeal junction, whereas lower part at the level of the tip of the coccyx. These are the levels where you are going to see the curvatures. Okay, next coming to the relations of the rectum. These are the relations of the rectum. First we are going to discuss here about the peritoneal relations. Okay, peritoneal relations. See, the green color one indicates the peritoneum. This is the rectum. This rectum is divided into three parts: superior one third, middle one third, and lower one third, or inferior one third. Superior one third, middle one third, and lower one third. The superior one third is covered by peritoneum on both anterior side, whereas also on the lateral side. See, this is the anterior view, and these are the lateral views. So the superior one third of the rectum is covered by the peritoneum on both anterior sides and also on the lateral sides, lateral surfaces of the rectum. Whereas coming to the middle one third, see, the middle one third is covered by the peritoneum on anterior surface of the rectum. Okay, on the anterior surface of the rectum, middle one third of the rectum is covered by the peritoneum, whereas in the upper or superior one third it will be covered on the anterior surface, whereas also on the lateral surfaces of the rectum. Okay. Next, inferior or lower one third of the rectum is subperitoneal. It is devoid of the peritoneum. Okay, it is devoid of the peritoneum. These are the peritoneal relations of the rectum. Okay, it's upper two third or superior one third, middle one third, and inferior one third. Superior one third will covered on both anterior and lateral surfaces, whereas in the middle one third it will be covered on the anterior surface. Okay, whereas in the lower one third it is devoid of peritoneum. Okay, it is devoid of the peritoneum. These are the peritoneal relations of the rectum. Okay, next coming to the visceral relations. Visceral relations anteriorly. Anteriorly, these visceral relations are related with the, in males it is different in males and females. First we are going to discuss here about the males, male relations, anterior relations in males. Okay, see, these are the rectovesical pouch. It is nothing but this peritoneum which will be reflects onto the base of the bladder. Okay, and it will forms a pouch. This is called as a rectovesical pouch. Okay, are also called as Denenwiller's pouch. Okay, rectovesical pouch. Okay, here this rectovesical pouch will be consist of colons. Okay, it consists of a sigmoid colons. Okay, coming to the relations here, it is related with the rectovesical pouch. This rectovesical pouch, which will be consist of a sigmoid colons, is nothing but a coils of the intestine, and also it will be related with the base of the bladder. Okay, this is the base of the bladder. Okay, and next it will be related with the terminal part of the ureters. Okay, here you are going to see ureters. It will be related with the terminal part of the ureters. Okay, and next seminal vesicles and ductus deferens and prostate. Okay, these are the structures which will be related anteriorly to the rectum. Okay, what are the structures which will be related anteriorly in the males? Rectovesical pouch, it consists of coils of intestines. Okay, and next base of the bladder, next seminal vesicles, vas deferens, prostate. All these structures are related anteriorly. Okay, posteriorly it will be related with the sacrum and coccyx. Okay, sacrum and coccyx, along with that you are going to see a piriformis muscle along with that sympathetic chain, and here it will be related with the anococcygeal ligament. Okay, these are the anterior relations in men, whereas in the females, see, in front of the rectum there is a one more structure. It is a uterus. Okay, this is the uterus and this is the bladder. So here rectouterine pouch. Okay, this is the rectouterine pouch. Okay, this rectouterine pouch would consist of a coils of the intestine. Okay, see this, and the in females the rectum will be anteriorly, the rectum will be related with the rectouterine pouch, which consists of a coils of intestines of sigmoid colon, and lower part will be related with the vagina. Okay, lower part will be related with the lower part of the vagina. Okay, this is the fundus of the uterus, this is the body, and this is the cervix. So this is the vagina. Okay, the lower part of the rectum which will be related with the lower part of the vagina. Okay, these are the anterior relations for the rectum in females. Next, coming to the posterior relations. This posterior relations is same for both in males and females. Okay, posteriorly it will be related with the sacrum and tip of the coccyx. Okay, sacrum and coccyx, and also it will be related with the median sacral artery, and also with the sympathetic chain, and also with the piriformis muscle, and also with the piriformis muscle and lateral sacral arteries. All these are related with posteriorly to the rectum. Okay, on either side of the rectum there is a recess. It is called as a pararectal fossa. Okay, there it is called as a pararectal fossa. Either side of the rectum will be related with the pararectal fossa. Okay, these are the relations for the rectum. Okay, next coming to the interior of the rectum. Interior of the rectum shows a mucosal folds. See, interior of the rectum shows a mucosal folds. These are two types. One is temporary and one is permanent. Temporary ones, which when the rectum will be distended, those folds will be disappear. So those are the temporary ones. Whereas permanent folds will be remain same. Okay. See, these are the temporary folds. The temporary folds are the longitudinal folds, where you are going to see in the lower part. Okay, in the lower part, we are going to see the temporary mucosal folds. Okay, those folds will be disappears when the rectum is extended. Okay, distension. Okay, next coming to the permanent mucosal folds are also called as a Huston's walls. Okay, Huston's walls. It is a very important question here. See. These are the permanent mucosal folds. These are 4 in number. Okay, these permanent hustation or permanent mucosal folds, those are 4 in number. Okay, see how these are arranged. These are looks like a semilunar or concentric transversely folded. Okay, these are arranged transversely folded, or these are looks like a concentric or semilunar in shape. Okay, it is situated against the concavity of the lateral curvature of the rectum. Okay, where it is present through the concavity of the lateral walls. Okay, concavity, it will be present and at the level of the concavity of the rectum, lateral curvatures of the rectum. Okay, here see there is a reduplication of mucous membrane containing a submucosal and the thickening of the circular muscles. See here there is a reduplication of the mucous membrane containing a submucosal tissue. This submucosal tissue thickening of the circles of the circular smooth muscles in the rectal walls. Okay, in the rectal walls. These are the permanent mucosal folds are called as Huston's walls. Okay, how these are arranged? These are arranged in a horizontal manner. Okay, these are arranged in a horizontal manner, whereas temporary folds are arranged in a vertical manner. Okay, these are concentric or semilunar in shape. It's along the concavity of the lateral curvature. Okay, which where it will place? It will place along the concavity of the lateral wall. Okay, these are permanent and becomes more prominent when the rectum is distended. Okay, these are more prominent when the rectum is distended, whereas the temporary one will be disappears when the rectum is distended. Okay, coming to the totally these are 4 valves. Okay, totally these are 4 valves, first and third. This is the first valve and this is the third valve. Okay, this is the second valve and this is the fourth valve. First and third valves are constant. Okay, where it will be lies? It will be lies towards the lateral wall, right lateral curvature. Okay, whereas second and fourth will be lies toward at the left side of the lateral curvature. Okay, first and third are constant, whereas second and fourth are inconstant. Okay, totally those are 4 valves, Huston valves or mucosal folds, permanent mucosal folds. Okay, first valve, where it is present? It is present at the rectosigmoidal junction. See, this is the sigmoid colon, this is the rectum, this is it junction between the sigmoid and rectum. Here you are going to see the first valve. Okay, this is called as a rectosigmoidal junction at S3 level. Okay, at the third sacral level. Okay, it is nearly 12 to 14 centimeters above the annus. This is the annus, where it will be lies. It will be lies 12 to 14 centimeters above the annus. Here you are going to see a first wall of the rectum. First valve of the rectum. Okay, where you are going to see the first valve of the rectum? Just above, about 12 to 14 centimeters above the anal orifice, you are going to see the first valve of the rectum. Okay, it is formed by the right lateral wall. Okay, it is formed by the right lateral wall of the rectum. Okay, next coming to the second wall or second fold, where it will be lies? It will be lies about 2.5 centimeters above the third wall. 2.5 centimeters above the third wall. It is nothing but the third wall will be lies about 5 centimeters above the anal orifice. Means 7.5 to 8 centimeters above the anal canal, you are going to see the second fold or second valve. Okay, it is projected by the left rectal wall. See, it is projected by the left rectal wall along the convexity of the upper lateral curvature. Okay, whereas the first valve is formed by the right rectal valve. Okay, Next, coming to the third wall. This is the this is the third wall. Okay, first wall, second wall, third, first, third, second, and fourth. See here. Third wall is the most important and constant wall. Okay, third one is the most important and constant wall. It will be formed by the right lateral wall. It is formed by the right lateral wall of the rectum. Okay, along the concavity of the middle lateral curve. Along the concavity of the middle lateral wall. Okay, it is also called as a Neilton sphincter. It is also called as a Neilton sphincter. Okay, where it will be lies 2 to 5 centimeters above the anal orifice. The third wall is present. Okay, this third wall, which will be divides the rectum into upper part and lower part. Okay, this third wall, which will divides the rectum into upper and lower parts. Okay, below that it is called as a rectal ampulla. Below that third wall, it is called as a rectal ampulla. Okay, next coming to the fourth wall. Fourth wall will be projected by the projection is formed by the left wall of the rectum. It is formed by the left wall of the rectum. Okay, along the concavity of the lower lateral curvature. Okay, where it will be less? It will be less 2.5 centimeters, means 1 inch above the third wall. Okay, this is about the walls of the rectum. Next, coming to the arterial supply, blood supply of the rectum. It is mostly supplied by the 5 rectal arteries. Okay, 1 superior rectal artery and 2 middle rectal arteries and 2 inferior rectal arteries. Totally, this rectum is supplied by 5 rectal arteries. 1 superior rectal artery, 2 middle rectal arteries, and 3 inferior rectal arteries. Okay. Next, coming to the venous drainage. Okay, this is the venous drainage of the rectum. Superior and middle rectal veins, which will be drains into the internal venous plexus. Okay, superior and middle rectal veins, which will be drains into the internal venous plexus, whereas inferior rectal vein will be drains into the external venous plexus. Okay. Next, coming to the nerve supply. Okay, nerve supply of the rectum. It is supply. It has both sympathetic and parasympathetic supplies. Okay, first here we are going to say about the sympathetic plexus. This sympathetic plexus will be arises from L1, L2 fibers. Okay, L1, L2 fibers. Those will be convey the impulses through superior rectal and inferior hypogastric plexus. Okay, it will be carry the impulses through superior rectal and inferior hypogastric plexus. Okay, it acts as a vasoconstrictor. It inhibits the musculature of the rectum. Which will be inhibits the musculature of the rectum. Okay, motor to internal sphincter. It supplies the motor fibers to internal sphincter. Okay, it carries a pain sensation. It carries the sensation of the pain. Okay, next coming to the parasympathetic nerve supply. Okay, it passes through S2, S3, S4, S4 fibers. Okay, it carries from S2 to S4 fiber. Okay, passes via pelvic splanchnic nerves. Okay, pelvic splanchnic nerves and inferior hypogastric plexus. Okay, to rectal plexus. From this pelvic splanchnic nerves and through inferior hypogastric plexus, it will be conveyed to the rectal plexus. Okay, motor fibers to the musculature of the rectum. Okay, which inhibits the internal sphincter. Okay, it carries the pain sensation and distension. Okay, distension of the rectum through parasympathetic nerve supply. Okay, this sympathetic nerve supply carries S2, S3, S4 fibers. Next, supports of the rectum. These are the supports of the rectum. What are the supports of the rectum? Rectum is supported by pelvic floor of the rectum. Okay, pelvic floor of the rectum and lateral ligaments of the rectum and next rectovesical fascia. Rectovesical fascia tendon is nothing but peritoneum of the rectum. Okay, peritoneal covering of the rectum. Next, pelvic peritoneum, and next perineal body and along with its muscles, and pelvic rectal and ischirectal fat. All these structures which will be supports the rectum. Okay, next coming to the applied aspects of the rectum. Okay, see, this is the perrectal examination. This is the perrectal examination. Okay, what is, why we are going to do this perrectal examination? To check the growth, to check for the growth in prostate enlargement. If there is any prostate enlargement, we are going to do the perrectal examination. Okay, and next in the women's, this will be if there is any problems in the reproductive organs like uterus and ovary, we are going to observe through this perrectal examination. Okay, and also where the causes of symptoms of rectal bleeding. Okay, while rectal bleeding, we are going to do this rectal examination. Okay, checking for the hemorrhoids growth. Okay, whereas it is an internal hemorrhoid or external hemorrhoid, all these things will be done through this rectal examination, rectal examination. Okay, next, rectal prolapse. Okay, this is the rectal prolapse. See, this is the normal picture, this is the rectal prolapse picture. Okay, incomplete or incomplete or mucosal prolapse of rectum is due to imperfect supports of the rectum. Okay, if the rectum is not supported by all the supports of the structure, see all about the structures. Okay, there is a rectal prolapse occurs in states. Okay, this is the rectal prolapse. Next, coming to the anal canal. Okay, rectum is completed. Next, we are going to discuss about the anal canal. Anal canal is also nothing but it is a terminal part of the large intestine. It is the last terminal part of the large intestine. It is called as the anal canal. Okay, it begins at the anorectal junction. It begins at the anorectal junction. This is the anorectal junction. Okay, a point 2 to 3 centimeters in front and little below the tip of the coccyx. Okay, below the tip of the coccyx, you are going to see a anal canal. Okay, this is the anal canal. What is the direction? It will be directed downwards and backwards. What is the direction of the anal canal? It is directed downwards and backwards. Okay, the opening at anal orifice is 4 centimeters below and in front of the tip of the coccyx. Where is the opening of the anal canal? It will be opens 4 centimeters below and in front of the tip of the coccyx. Okay, this is the site where the anal canal will be opens. Okay, next, coming to the peculiarities of the anal canal. See, anterior wall is shorter when compared with the posterior wall. Okay, anterior wall of the rectum is shortened when compared with the posterior wall. Okay, this anal canal will be surrounded by a sphincter ani muscle. Okay, it is surrounded by a sphincter ani muscle. The tone it closes the anal canal. Okay, tone of it closes the anal canal. It opens only during defecation. This anal canal will be opens during defecation. Okay, these are the main peculiarities. Okay, the anterior wall of the anal canal is shortened when compared with posterior wall. Okay, it is surrounded by a anal sphincter. Okay, it will be opens during defecation. Okay, next, coming to the anal canal measurements. It will be measures about 4 centimeters in length. It will be measures about 4 centimeters in length. Okay, breadth of the anal canal is variable. Okay, it will be variable. It will be different from okay. Next, this when empty lateral walls are approximated anterior posteriorly, the slit will be looks like. Okay, the slit will be looks like anterior posteriorly. Okay, length of the anal canal is nearly 4 centimeters. Its breadth is variable. Okay, next, coming to the relations of the anal canal. Anteriorly, see, this is the male picture and this is a female picture. Anteriorly, the anal canal which will be related with the perineal body. Okay, in both in males and females, anteriorly the anal canal will be related with the perineal body. Okay, whereas in males it will be related with the membranous urethra. See, it will be related with the membranous urethra and bulb of penis, whereas in females it will be related with the lower end of the vagina. Anteriorly, In females, it will be related with the lower end of the vagina. Okay. Posteriorly, it will be related with the anococcygeal raphe or anococcygeal ligament and tip of the coccyx. Anal canal, posteriorly, it will be related with the anococcygeal ligament and tip of the coccyx. Okay. Laterally, it will be related with the ischirectal fossa. On either side of the anal canal, you are going to see a ischirectal fossa. Around that, here you are going to see the sphincter muscles with tone of which keeps the anus pin closed. Okay. Around that, sphincter muscles are present. Okay. Anteriorly, it will be related with the perineal body, whereas lower end of the vagina in females, whereas membranous urethra along with bulb of penis in males. Okay. Posteriorly, it will be related with the tip of the coccyx along with anococcygeal ligament. On either side, it will be related with the ischirectal fossa. Around that, it will be related with the sphincter muscles. Okay, these are the relations for the anal canal. Okay, interior of the anal canal. Here it is also very important here. Interior of the anal canal. See, this is the interior of the anal canal. It divided into three parts: upper area, intermediate area, and lower area. This is the upper area, this is the intermediate area, and this is the lower area. Okay, upper area is having, it will be extends up to the pectineal line. It will be extends up to the pectineal line. This is the pectineal line. Okay, and intermediate area which will be extends up to Hilton's white line. This is the Hilton's white line. This is the intermediate area. This is the upper area, and this is the lower area. Okay, lower area is called as a anal wedges. Okay, intermediate area is called as pectin area. Okay, these are the three areas we are going to see in the interior of the anal canal. Okay, upper mucous area, upper mucous part. Its length is nearly 15 millimeters in length. Its length is nearly 15 millimeters long. Okay. It is endodermal in origin. Its origin is in endodermal in origin. Okay, it consists of 6 to 10 mucosal folds. It consists of 6 to 10 mucosal folds. These are the mucosal folds. These mucosal folds are called as the anal column of Marconi. Okay, anal column of Marconi. These are the anal columns of Marconi. How these anal columns of Marconi are formed? These are formed by mucosal folds. These are nearly 6 to 10 in number. Okay. In between this anal column, you are going to see an anal sinus. This is the anal sinus. Okay. Anal valve. Anal valves all together forms a pectineate line. Anal valves or valve of balls all together forms a pectineate line. Okay. This is the pectineate line. This is about the upper area. Okay. Upper mucosal part. It consists of anal column of Marconi and next anal sinus. Okay. And this downward projection of anal column is called as an anal papillus. These are the anal papillus. Downward projection of anal column is called as an anal papillus. Okay. These are the anal papillus. Okay. All this together forms a pectineate line. All this together forms a pectineate line. Importance of the pectineate line. It divides the anal canal into upper and lower areas. Okay. What is the importance of the pectineate line? It divides the anal column into upper area and lower area. Important anatomical landmark for several distinctions. Okay, anal papillus. These are the anal papillus. Okay, next coming to the lower cutaneous part. This is the lower cutaneous part. Okay, this lower cutaneous part is nearly 8 millimeters in long. Nearly 8 millimeters in long. It is derived from ectodermal in origin. It is derived from ectodermal in origin. Whereas upper part is an endodermal origin, whereas lower part is an ectodermal in origin. Okay. It is covered by true skin with pigmentation. It is covered by true skin with pigmentation. It consists of mainly sweat glands and sebaceous glands. Okay, the lower part mostly consists of sweat and sebaceous gland, and it consists of a hair. Okay. Next, coming to the musculature of the anal canal. Musculature of the anal canal. This is the internal anal sphincter, and this is the external anal sphincter. Okay, this internal anal sphincter is thickened. It is thickened, and these are arranged in a circular manner. Okay. Okay, it is an involuntary muscle. These are arranged in a circular manner. Okay, it is an involuntary muscle. Okay, this is the internal muscle or internal sphincter muscle. Okay, and next this is an external anal sphincter. Okay, these are the striated muscle. This is a striated muscle, whereas this is a circular muscle. This striated muscle is a voluntary muscle. Okay, whereas internal sphincter is an involuntary muscle. This is a voluntary muscle. Okay, it is divided into three parts. Okay, superficial part, this is a subcutaneous part, and this is the superficial part, and this is the deep part. Okay, this external sphincter ani is divided into three parts. Okay, or three groups: subcutaneous part, superficial part, and deep part. Okay, this is a voluntary sphincter ani muscle. That is the musculature of the anal canal. Okay, it is having external and internal anal sphincter, whereas internal sphincter is involuntary, whereas external sphincter is voluntary. Okay, next, this is the important facts of the anal canal. Okay, this is the lymphatic drainage. Above pectinate line, below pectinate line. Above pectinate line, it will be drains into the internal iliac lymph nodes. Okay, whereas below it will be drains into the superficial inguinal lymph nodes. Okay, next epithelium. This is the columnar epithelium, whereas this is a stratified squamous epithelium. Stratified squamous non-keratinous epithelium. Okay. Embryologically, it is above pectinate line, it is a endodermal in origin, whereas below pectinate line, it is an ectodermal in origin. Why? Because it is a cutaneous. Okay. Arterial supply. Above pectinate line, it is supplied by superior rectal artery. Okay. Coming to blood supply, above pectinate line, it is supplied by superior rectal artery. Below pectinate line, it will be supplied by inferior rectal artery and middle rectal artery. So finally, rectum is supplied by finally anus is supplied by superior rectal artery, inferior and middle rectal arteries. Okay. Next, veins drains into superior rectal vein. Above the pectinate line, it will be drains into the superior rectal vein, whereas below the pectinate line, it will be drains into middle and inferior rectal veins. Okay. Next, say main important clinical feature here is hemorrhoids. Okay, above the pectinate line, here you are going to see internal hemorrhoids. Internal hemorrhoids are not painful. Okay, these are not painful. Okay, below the pectinate line, here you are going to see the external hemorrhoids. External hemorrhoids are very painful here. Okay, and next, nerve supply. Nerve supply here, inferior hypogastric nerve plexus. Right? Sympathetic L1 and L2, whereas parasympathetic by S2, S3, S4. Okay. Below pectinate line, it will be supplied by inferior rectal nerves. Okay. These are the important features about the anal canal. Next, coming to the applied aspects of the anal canal. Okay. Hemorrhoids are piles. Hemorrhoids are also called as piles. Okay. It is nothing but internal hemorrhoids and external hemorrhoids. Okay, where you are going to see the internal hemorrhoids above the pectinate line. Okay, below the pectinate line, we are going to see external hemorrhoids. Okay, see, these are the tributaries for superior rectal veins. Okay, external hemorrhoids are formed by tributaries of the superior rectal veins, whereas internal hemorrhoids are formed by the tributary of inferior rectal veins. Okay, these hemorrhoids are piles mostly occurred by the veins. Okay, these are occurred by veins. Dilatation of the veins causes these piles or hemorrhoids. Okay, these internal hemorrhoids are generally painless. Okay, these external hemorrhoids are very painful. Okay, this is about the hemorrhoids or pains. Okay, see, this is the anal canal. Okay, by seeing the position of this hemorrhoid or piles hemorrhoids, we are going to see the position. Anterior, right anterior primary pile is called as a lemnoclock piles. Okay, this is the site for the lemnoclock piles. Okay, and next, right posterior primary pile is called as a 7 o'clock piles. Okay, it is called as a 7 o'clock piles. In between that, it is called as a secondary piles. Okay, next, whereas left lateral primary pile is called as a 3 o'clock position of the pile. Okay, these are the positions of the piles, primary and secondary piles. Okay, and next, here are all the anal fissures. See, these are the anal fissures. Okay, these are the anal fissures. Here you are going to see the anal fissures. Okay, is nothing but repeat of one of the wall. Okay, repeat of it is lined by the mucous membrane and skin. Okay, it is lined by the mucous membrane and skin. Okay, next anal fistula. Anal fistula is nothing but abnormal epithelialized tract connecting the two cavities, connecting the cavity one from the abscess to next anal canal. Okay, this is called as a anal fistula. Okay, anal abscess is nothing but collection of pus near to the anus due to infection of the anal glands. Due to infection of the anal glands, there is a collection of pus around the anus. Okay, this is called as an anal abscess. And next, rectal inconvenience. Okay, damage of anorectal ring results the rectal inconvenience. Okay, these are the anal disorders. Okay, and these are the hemorrhoids, internal hemorrhoids, and these are the external hemorrhoids. Okay, internal hemorrhoids are less painful, whereas external hemorrhoids are very painful. Okay, next, this is about the anal canal. Next, we are going to discuss about the ischirectal fossa, where you are going to see the ischirectal fossa. Okay, see, on either side of the rectum and anus, you are going to see the, on either side of the anal canal, you are going to see the ischirectal fossa. Okay, coming to the perineum. What is perineum? Where it is present? Perineum is nothing but it is an area. It is an area. It is an area or anatomical region in the pelvic outlet. In the pelvic outlet, we are going to see the perineum. Okay, in between the upper part of the two thighs. In between the upper part of the two thighs. It is the area in where you are going to see in the lower part of the pelvic outlet. In the lower part of the pelvic outlet. Okay, in between the two up, in between the upper part of the two thighs. This is the area of the perineum. Okay, this area of the perineum consists of external genitals and anal opening. Okay, here you are going to see the external genitalia and anus. Okay, this is about the perineum. Next, coming to the boundaries of the perineum. Okay, anteriorly it will be bounded by the lower margin or inferior margin of the pubic symphysis. Okay, anteriorly it will be related with the pubic symphysis and pubic arch, and anterior laterally it will be related with the pubic ramus, ischial ramus, ischio-pubic ramus, along with ischial tuberosity, along with ischial tuberosity. So, ischio-pubic ramus and ischial tuberosity. Anterior laterally it will be related with the ischio-pubic ramus and ischial tuberosity. Okay. Posterior laterally it will be related with the sacrotuberous ligament. Posterior laterally it will be related with the sacrotuberous ligament. Okay. Posteriorly it will be related with the sacrum. Sorry, posteriorly it will be related with the coccyx. Okay. These are the boundaries of the perineum. Anteriorly by the inferior surface of inferior border of the pubic symphysis, whereas anterior laterally by ischiopubic ramus and ischial tuberosity, posteriorly by the tip of the coccyx, and posterior laterally by the sacrotuberous ligament. And next, this is an imaginary line. A imaginary line will be drawn from the anterior end of the ischial tuberosity. This is an imaginary line. This imaginary line divides the pelvis into, divides the perineum into anterior urogenital triangle and posterior anal triangle. Okay, anterior urogenital triangle and posterior anal triangle. Okay, so this is about the perineum. Okay, where you are going to see this ischirectal fossa in the anal triangle. On either side of the anal opening, you are going to see a ischirectal fossa. It is also an important question. Okay, that's why we are revising repeatedly. Okay, this is the third time of the revision. Okay, see here. First, we are discussing about the anal triangle. Where you are going to see the anal triangle, a imaginary line which will be drawn at the anterior ends of the ischial tuberosity. Okay, this is the site for the ischial tuberosity. This is the imaginary line. Okay, this triangle is called as an anal triangle. In front of this imaginary line is called as a urogenital triangle. See here you are going to see a urinary openings. Here you are going to see anal opening. Okay, by these openings only they have decided the name as a urogenital opening, urogenital triangle, and anal triangle. Okay, see here we are going to discuss about the anal triangle. Okay, what are the structures in the midline of the anal triangle? See, this is the perineal body. Okay, this is the perianal canal opening. Okay, along with the anal sphincter. Okay, this is the sphincter and externus muscle. Okay, this is the anal sphincter. Around that, this is the anal sphincter. Okay, external anal sphincter. And next, this is the anococcygeal raphe. This is the tip of the coccyx. Okay, these are the midline structures. From before backwards, it is a coccygeal body, and next anal opening along with its external anal sphincter, anococcygeal ligament, and tip of the coccyx. Okay, on either side of this anal canal opening, this space is called as a ischirectal fossa. Okay, this ischirectal fossa is a wedge-shaped lining. Okay, it is a facial lining, wedge-shaped space on either side of the anal canal. See, this is the anal canal. Okay, what is ischirectal fossa? Ischirectal fossa is nothing but it is a facial lining, wedge-shaped space on either side of the anal canal. It is called as a ischirectal fossa. Okay, it consists of apex, base, medial wall, lateral wall. Okay, these are the boundaries for the ischirectal fossa. See how the apex is formed. Apex is formed by the fusion of anal fascia along with the internal obturator fascia. This is the internal obturator internus muscle, and this is the levator ani muscle. Okay, the inferior surface of the levator ani is covered by a anal fascia. Okay, obturator internus muscle is covered by a obturator fascia. Where these two fascias will be meets, this point is called as the apex of the ischirectal fossa. So this is the apex of the ischirectal fossa. Okay. Next, coming to the base. Base is covered by skin and superficial fascia. Okay. Base is covered by skin and superficial fascia. Okay. Next, medial wall. This is the medial wall. Medial wall is sloping downwards medially. Okay. Medial wall is sloping downwards medially. Okay. Apex will be directed upwards above. Okay. Base will be directed below. Okay, medial wall will be directed sloping downwards medially, whereas lateral wall is vertical. Okay, medial wall is formed by levator ani muscle along with its levator ani fascia, and see in the lower part here you are going to see the sphincter ani externus muscle. Okay, these two are the medial boundaries of the ischirectal fossa. Okay, lateral wall is bounded by obturator internus muscle. Lateral wall is formed by the obturator internus muscle along with its obturator covering fascia. Okay, these are the boundaries of the ischirectal fossa. Okay, it is a wedge-shaped facial lining space. Its apex is directed above. Okay, its base is directed below. Apex is formed by a meeting point of the fascias of levator ani fascia along with the obturator internus muscle fascia. Okay. Base is formed by skin and superficial fascia. Okay, and next medial wall is formed by sloping downwards medially. It is formed by levator ani muscle and external anal sphincter muscle. Okay, lateral wall is vertical, which is formed by the obturator internus muscle along with its lining obturator fascia. Okay, and this space consists of a fat. Okay, it consists of a fat. Main content of ischirectal fossa is a fat. Okay, see here, this is the fat. Next, coming to the contents of this ischirectal fossa. Okay, the main content of the ischirectal fossa is fat. Okay, this fat will be acts as a cushion. Okay, it acts like a cushion. Okay, so while defecating the anal and rectal walls, which will be distended into this fat of the ischirectal fossa. Okay, this is the main importance of this ischirectal fossa. Okay, see what are the main contents here. Inside the Alclox canal, see this is the Alclox canal. Okay, this is the Alclox canal where you are going to see on the lateral wall of the Ischirectal fossa, you are going to see a Alclox canal. Okay, this Alclox canal, which will be consist of Alclox canal, are also called as a pudendal canal. It consists of internal pudendal vein, internal pudendal artery, and pudendal nerve. Okay, these are the important structures. It is also one of the 2 marks question. Pudendal canal or Alclox canal. Okay, where you are going to see on the lateral wall of the ischirectal fossa, you are going to see the pudendal canal. Okay, it consists of internal pudendal vein, internal pudendal artery, and pudendal nerve. Okay, outside the pudendal canal, see, this is the outside the pudendal canal. It consists of a fat. Okay, it consists of a fat which acts as a cushion like. Okay, this is the, it consists of inferior rectal artery, inferior rectal vein, and inferior anal nerve. Okay, here it consists of inferior rectal artery, inferior rectal vein, and inferior anal nerves. Okay, these are all the contents of the ischirectal fossa. Okay, next, coming to the recesses. It has 2 recesses. Recesses is nothing but extension of the fossa. Okay, it is nothing but extension of fossa beyond its boundaries. Okay, extension of the fossa beyond its boundaries. It is called as a recesses. It consists of anterior recess and posterior recess. See, anterior recess, which will be extends forwards above the perineal membrane, and reaches up to the posterior surface of the body of the pubis. It will be extends up to the posterior surface of the body of the pubis. Okay, it will be related with the vagina and prostate. Prostate in males, whereas vagina in females. Okay, this is about the anterior recess, which will be extends forwards above to the perineal membrane, reaches up to the posterior surface of the body of the pubis. Okay, it will be related with the vagina in females, whereas males it will be related with the prostate. Okay, whereas posterior recess, which will be extends deep to the sacrotuberous ligament. Okay, it will be leads up to the sacrotuberous ligament. Okay, this is the sacrum, this is the tip of the coccyx. Okay, this is the sacrotuberous ligament. The posterior surface, which will be extends up to the sacrotuberous ligament. Okay, this is smaller than the anterior recess. Okay, these are the 2 recesses of the ischirectal fossa. Okay, next, coming to the applied aspects of the ischirectal fossa. Contents of the fossa are closely lobulated. See, here the fat is arranged in a lobules, which permits the distinction of the median anal canal. Okay, this is the main important here. An abscess in the ischirectal space may be burst into the anal canal, produces a fistula in ana. Already I had shown you in previous slide in the applied aspects of the anal canal. Okay, fistula in ano. Okay, abscess from one fossa may spreads into the opposite side behind the anal canal. Okay, this is a horseshoe shaped abscess. Okay, horseshoe shaped abscess of ischirectal fossa. Okay, pudendal nerve can be blocked in this pudendal canal on either side by to give regional caudal anesthesia. Okay, regional caudal anesthesia. Okay, this fossa contains, okay, this ischirectal fossa, it does not have any important structures, and it therefore incision can be given when this area will be infected. It will be infected mainly through abscess, anal abscess, perianal abscess. Okay, these are the more main important clinical aspects in the ischirectal fossa. Okay, these are the main important topics we are revising repeatedly, so you read well. Okay, rectum, anal canal, and ischirectal fossa. Okay, thank you.